Welcome to the Silicon Fox podcast, where we explore the habits and stories of high performers. Join us as we dive into their journeys, analyze live blood tests, and break down the science behind key biomarkers to help you optimize your health. I'm your host, Mitchell Eschner, an ex-pro soccer player, a current sponsored hybrid athlete, a health tech founder, and a longevity enthusiast. Awesome. Well, thanks for hopping on the pod, Max. It's great to have you.
Great to be here.
I have a really pressing question. So, function, Cyphox, Superpower, I'm seeing a lot of people offer biological testing. And I know like Brian Johnson definitely made this popular with like reversing biological age. Like what is it based off of? Or I guess like can you add some insight into like biological age, like what that reversal looks like?
I think that people want to understand what's happening inside of their bodies, and they don't want their ability to do so to be gated by complex systems and processes. And now there is a set of companies which give people the control and ability to actually see what's going on. I think that we're entering a decade where the most important problem in existence becomes existence, extending human life and enhancing human life. And testing is upstream of knowing the kinds of actions that you need to take to extend and enhance human life. In terms of biological age reversal, I think most of the things that exist today will not do an effective job of biological age reversal. Of 60 billion people to ever live on Earth, no one has lived past 140. And the implication is no amount of diet, exercise, sleep is going to reliably help us live past 140. I think the actual answer is going to be deep biotech. And I think that's actually more interesting than micro optimizations around biological age.
Yeah, but like so right now, like some of the current metrics on like reversal, it's just based off of biomarkers or like what is it usually using as a benchmark?
They're nearly always some sort of biological assay. They test different things. So there's PhenoAge, which a lot of companies use, which is basically a regression of several common immune and inflammatory biomarkers against time to death. There's DNA methylation clocks. There's organ age. There are all sorts of different measures of biological age. Most of them are very good single biomarkers at predicting overall health and time to death. If you only had a single biomarker, these biological age ones are probably the most important biomarker because they're an aggregate or composite of many others. I think calling them biological age is a little bit misleading, right? Because if you're 90 and your biological age is 30, it does not mean you're going to live for another 60 years.
That's fair. That's my fun question is I feel like people are gamifying the process. And so I want to be a lot younger than I actually am. So huge congrats on the Series A. I saw that actually that went what was that, a few days ago? You guys put that out publicly?
Yes, we announced that yesterday.
That's awesome. So I kind of, from my understanding, you guys are building the space of like, every consumer is going to have this super app, health and whatnot. So I think it probably gives you a good position to say, what is the end goal? What does healthcare look like 5 years from today? Are we really all in control of our health? Kind of give us some color there.
We believe that every single person is going to have an AI doctor within a super app on their phone. And that is going to be the primary way people access care before Google, ChatGPT, or their primary care doctor. And this system will be better. It won't just match the best doctors in the world. It will exceed the best doctors in the world because healthcare is fundamentally a informatics problem, computing between the database of medicine and the database of what we know about the patient. Today, we're still trying to solve that with human brains. 5 years from now, I suspect that we laugh at the fact that we tried to solve that with human brains. The implication is that healthcare becomes a tool to prevent and detect disease years or decades in advance. And once prevention is table stakes, healthcare becomes a tool to actually enhance human capability. It's no longer about merely curing sickness. It's now about actually extending the frontier of what's possible for humanity.
Okay, interesting. Yeah, the second part will be interesting because I guess my fundamental question on like the business side, when people are building businesses here, like how do you actually get the incentives to align? Because this at its core aligns incentives with the consumers. But over the long run, if everyone is participating in preventative medicine, and you kind of get the hang of things, is there a strong need then for consistent, like, agentic medicine, if you will, where like I'm constantly tracking things, where maybe I kind of get the hang of habits and I don't want to be hyper obsessive or metrics. So if like, because a lot of products that get people, let's say, off nicotine, is a good example. In the end, they're kind of self-destructive because the product itself is no longer needed when someone is off nicotine. So I guess in the healthcare space, it's not as clear tied because health is kind of a foundational thing. But right now the model works because a lot of these like businesses and systems want you to stay sick so that they can help, have you consistently coming, and like there's this recurring revenue model and the whole insurer payer space. How does it change if people are actually getting healthier and I just need less involvement from healthcare?
Um, I don't know. I think it's very hard to make those kinds of bets because we're betting that the system is static. We're betting on a directionality of change around the patient. We're betting at the level of like incentives. There's a lot of different inputs which will determine the outcome for a health system. So I think it's harder to predict that. I think what's far easier to predict, like I think it's far easier to say, what do we know today? And what we know today is that in the limit, or what do we know in the right? They're the only two things we know. What do we know today, and what do we know in the limit? And then somewhere between them, we find the answer. One thing we know today is that people want to be healthy. True, that's going to be true in the limit. One thing we know in the limit is that we're more likely to be preventing disease than reacting to disease. We're more likely to be using more data than less data. We're more likely to be personalizing care than not personalizing care. So I prefer to anchor any sort of prediction around either what do we know today or what do we know in the limit rather than complex systems predictions, because I think it's actually very hard to take action around the complex systematic prediction. And I think the other answer to that is that these systems will evolve. Like, yeah, sure, they do one thing today, but they never used to. 50 years ago, these systems didn't treat cancer. They didn't treat a lot of the things they do today. So I do think they evolve, and we can't assume that the system is static either.
Yeah, that's super fair. And you're kind of like, you referenced it a few times, but the agent side of it. So I guess like, are we trending towards having a bunch of health data and having an agent analyze it and kind of give you an output of like, here's the things you need to do and here's the analysis I've noticed about you?
Yeah, I think that there's two paths. One is humans are agentic and we make decisions. The other path is that humans follow the algorithm or follow the AI or follow the agent. I think the latter is almost inevitable because there's going to be so much data and so much information such that the AI knows more than us, way more than us. And we only know that it knows way more than us. That's all we know. And the implication is we follow it and we listen to it and we do what it says. And in that world, agents are delivering our care rather than us autonomously, constantly making decisions and processing data.
So I guess from a high level, this is super fair, and I've been hearing this a bunch from like a lot of the health and wellness companies. And I run a company in the space that also kind of has a similar thesis. But what's interesting to me is like, if we're actually provided all this data, what do we do with it? And do we actually know what to do with it? It's probably the second biggest question. Because my hunch is, if I go to a physician today and I give this physician all of my, and I'd say I get a blood lab once a month, and I give them 12 times the blood labs than I'll usually have, or even 24 times, my hunch is most physicians won't actually understand those trends. They may go with their same playbook and say, oh, I see trends up. I see, your glucose is up, your glucose is down. But what does that actually mean? As opposed to what they're trained in medical school of like, you have like a yearly physical and all these kinds of things. So, and your agent is only as good as your inputs. So like the next really, really fundamental question becomes, do we even have the capabilities? Are we entering a whole new era of research where like, hey, if we actually track someone incredibly closely, more data will actually imply better outcomes because we can track things earlier, because we haven't done that yet. And a lot of like medical schools and all these kind of systems that put out people that are in the medical profession, they wouldn't know what to do with the data. And so even when we train the models, we don't know what data to input because we haven't done it before.
The models are going to link omic data to clinical data and discover things that we don't know today. And the implication is when we have this closed loop system between input and output, the models learn versus us having to explicitly train them. The point of data is not for us, right? Everyone says, oh, I don't want to look at my Aura ring and I don't want another wear. I don't want to read the data. It's not the point. The point of more data is for the algorithm, right? In a world where if we truly believe that the algorithm gets exponential in its ability to understand what we want and take action and tell us what to do, whereas we more or less stay flat, maybe improve a little bit. The implication is we have to follow the algorithm. And in that world, the right question is not, do people want to see the data from the Aura Ring? The right question is, do they believe that that is an input into the algorithm that improves every part of their life? And I think they will. And I think in that world, more data is far easier to comprehend and grok than the world of assuming people have to process every single input themselves.
Yeah. I mean, at a high level, that's absolutely exciting to like play the pessimistic role. I guess like if health becomes much more consumer based, does that not mean consumers have to be much more educated, or like when
No,
consumers also
the
just
algorithm has to. Like they will end up being educated because it will be in zeitgeist and interesting and fun. I don't think they have to. I think again the implication here is that the algorithm knows way more than you ever know, and as a result, you don't have to. So there are examples of this, right? When driving first came out, you had to be pretty educated about how a car worked. And the more technology we put into a car, the more software we put into a car, consumers had to be less and less educated. It was more complex, there was more data, there was more going on, but the consumer now could relinquish a lot of that to the software or the algorithm. That's driving a car. The same is true of aeroplanes. The same is true of computers. Right? There didn't even used to be a graphical user interface. There didn't used to be a like trackpad or mouse. You really had to understand computers. And the better computers got, the more common they got, the less humans actually had to understand how the thing works and how to interface with it. And I think the same is true for health.
That's actually a great point. That makes it interesting. Like it doesn't like I guess the biggest fear is if it becomes a content game of like if you have one of these companies and there's a lot of trust in the company, then it's great, right? Like, you know, if the company's incentives are aligned to keep people healthy and there's like a kind of a monopoly in the market, and they're not squeezing for margins, but they're squeezing for health improvements, that's great. When you have three players and everyone's trying to kind of squeeze for some market share, and you have algorithms that are maybe more hyper personalized, but now you're upselling and now you're doing all these other things, you kind of break the whole purpose that you even started in the first place. It's like, does it kind of become a content game, or do you envision a world in which we live in where there's just kind of one winner, and we just like the core of the way, you know, you brought up the car example, the same way that we just kind of believed the way cars were built, we're going to start believing the way healthcare is given to us moving forward.
Yeah, well, I think if we look at the car industry, how many winners are there? There's definitely not one. And I think if we look at just about any industry, there's typically not one winner, but there are also not 50 winners, right? So I suspect we see in healthcare what we see in many other industries, which is a small number of companies with slightly different products that people choose between, akin to how you might choose between Samsung or Apple or Tesla or any of these Tesla competitors coming out. I suspect that's what we see in healthcare.
Yeah, I mean, so like, do you think the game is a lot less focused and one based off of content? Like, I guess what becomes the metric for excitement for consumer? Because before, you know, now in the medical infrastructure, I'll go to a hospital and whatever my insurance covers is where I'll go. Geographically is kind of where I'm focused on. There's a different metric of like
Yeah,
evaluation.
it's three. It's access, quality, and cost. And I think that people will make slightly different trade-offs against all three, and people will buyers will vote based on where they want to sit on that trade-off spectrum. But they're typically the three levers you have to play with, and uh, the company that wins is typically the one that's simultaneously the highest quality and low cost and hyper convenient. Sometimes they decide to say we're going to go really high quality at the expense of cost. Apple being an example, but they're the three vectors that matter. I don't know if I fully understand what you mean by content. Maybe you mean like medical content or something or data.
I mean, like, you know, right now to reach a consumer, it comes via certain distribution channels. The second, like, you get health pushed by your provider or whatnot, then it's a different story. But right now, the likely way you'll get onto some of these platforms that are, you know, blowing up in this consumer faced health world, it's like social media. And so, like, if I have a better,
And yeah, I
yeah,
get you. Is the player that wins the one that does the customer acquisition the best?
yes,
No. It's the player that wins is the one that does everything the best. There's
yeah,
the
that's fair.
meme in Silicon Valley of like, what matters more, product or distribution? You have people like going, the reality is you have to do everything really well. Like Apple has a fucking amazing product and fucking amazing distribution. Tesla
Yeah.
has a really great product and really, really good distribution. just about every company that does a great job has to do most things really, really damn well. There'll be some companies that are a little bit more product forward and some that are a bit more distribution forward. True, but every company is going to have to focus on all of those things and do all of them really well. I think the second you assume that you can just do one of them, you can just do content, and that's going to determine who wins. You might have a good short-term optimization, but good luck 5 years from now when everyone else is a 10x better product.
Exactly. I think like where the comparisons are a little bit harder is like this is healthcare, right? Like for a lot of people, this is life or death. And so some great businesses in other industries are built off of distribution alone and an okay product.
Well, I don't know. I contend that healthcare classically distribution has mattered more so than in other industries, and healthcare is notorious for that.
But
So I don't know if I
that's my point
necessarily
is
agree with that. Yeah.
that's my point. It's a problem. My point is not that it's like it doesn't exist. My point is it exists and it's a problem because the second it becomes consumer focused and people build a bunch of brands, like and I have the best social media presence and now I have a massive brand that I built with like an okay product that's not giving you much value, but you are kind of living off of. That's the concern, right? So
Well, I
like
think the
that's why I
opposite
think
happens. That is healthcare today. Healthcare
okay,
today is the best distribution always wins, the best product never wins.
okay.
And that's because consumers don't vote. Consumers aren't paying, they don't vote, they aren't making complex comparisons. It's really, really damn hard to make complex comparisons. You throw insurance into it and geography into it. And the reality is, healthcare today, the best product does not win, doesn't even get close to winning. What happens when things consumerize is that the best product, it starts to become way more meritocratic. People start paying, people start comparing, markets operate more like free markets, which increases competition, which increases product quality. So I actually think the consumerization of healthcare means that product starts to matter more and distribution matters a little bit less.
Yeah, that's super fair. How do you like I know a unexciting part of the business, but how do you think insurance plays a role into this?
I think that healthcare in the limit will still likely be free and should be free. Um, so I suspect that insurance is going to be an uh, important piece for any health company. But the opposite could be just as true. Like the opposite could be true, which is actually a lot of things that used to be free, people now pay for, and healthcare is not an exception. We used to get free TV, now everyone pays for like 50 fucking subscriptions. We
Yeah.
used to have free landlines, now everyone pays stupid amounts for a mobile phone. Um, we used to get public transport, which is just about free, and now like everyone's Ubering around. And the learning there is that once the product is good enough, people choose to pay. I don't know how this merges in healthcare. My bet today is still that when you have an equivalent product and one is free and one's not free, the free one wins. And insofar as insurance makes it possible to make an equivalent product free, insurance matters, and companies should be focused on insurance.
Yeah, that's super fair. We touched on distribution a good bit of how it's built today and how it's going to be a pivotal part of the future. I think you guys have done an awesome job of building a great health brand. What are the biggest tips and tricks for building a great health brand in today's world?
I think that a lot of it starts with deeply understanding cultural zeitgeist and the emotions of what customers want. I think that there are a lot of really smart founders who start with the technology or the strategy or the things the VCs want to hear. And the reality is that if you want to create a cultural movement and a brand that people love, akin to a Nike or an Apple, something emotional, it starts with deeply understanding the psychology and zeitgeist and feelings of customers. I think companies can either be customer first, engineering first, design first, operations first, etc. I think that it's most of the great companies are customer first. They obsess over, they start, rather than starting with, is this technically feasible or not feasible, or is this complex or non-complex from an operational standpoint, they start from what is the optimal experience for customers, and they work backwards from that. And I think that also applies to branding and marketing. I think we all need to be a little bit less logical, maybe a little bit more emotional, because that allows us to tap into zeitgeist in a unique way.
What were like some of the most interesting or unique growth things that you guys did? And I guess like any stories or examples would be awesome.
We believed right from the start that the next great healthcare company would have a cult-like brand. And we saw that there was no healthcare company today that really had that. There's no one walking around wearing One Medical t-shirts or Hims t-shirts. There's no real Nike or Apple of healthcare. So one of the things we have is what we call Superpower Labs, which is a brand marketing engine where we every few months do a drop of some sort. One of the drops we did last year in December was what we called our world's healthiest hoodie, which was a fully organic, 100% organic cotton, 0% toxin, zero dyes, a really high quality hoodie. And it was beautifully designed, really thoughtful. The packaging was thoughtful. The website was stunning, healthiesthoodie.com. And we dropped that and we shipped them to our influencers and investors who posted about it. And the hoodies sold out within a day, within a couple of hours. We had people listing them on Grailed and eBay for $2,000. And it made people start to love the brand. Right? And now we have over thousands of people walking around wearing these hoodies and people asking, what's Superpower? And they don't only say Superpower is X, but now they have the story of the hoodie. And what the story of the hoodie communicates is these guys care about the small details. They care about the small things that add up to make our health, right? That was one example of a brand marketing drop that went quite viral.
What do you think are like some of the most underutilized techniques, specifically in the health tech space, that people aren't using right now, that maybe you guys are fans of?
I think that most of the companies I see succeed start quite narrow and vertical and have one channel that matters more than just about every other channel. So I think that a lot of companies would be well served by trying to simplify what they're doing as much as humanly possible. Basically, have a very, very clear value prop to customers and then focus on one channel which you hypothesize or have evidence of will lead to good outcomes. That might be B2B through clinics. It might be growing on Twitter and LinkedIn by getting people to post. It might be partnering with one mega influencer. It kind of depends on the nature of the product. But I think there's typically one thing which matters more than everything else. Obsess over finding that thing and doing that almost at the exclusion of everything else.
Yeah, that's super. That's super fair. Well, thank you so much. I would love to jump in a quick rapid fire. I'll just give you a quick question and just gonna give me the first thing that comes to mind.
Yeah, let's do it,
What
man.
what's one health belief you've completely reversed in the last year?
I think red wine in small amounts can be better for you than no red wine.
As in, you used to think it was. This is true, or now you think what
I'm
reversed?
now pro red wine.
Okay, interesting. What's the worst advice you've seen in the wellness world?
I think most dogmatic diets or trends are pretty bad. I think that red meat is overplayed and Ray Peace is overplayed. I'm going to get cancelled on Twitter for that. I think that there are elements of those diets which are really powerful. And I think that in a modern world where we're surrounded by a lot of shit, it's better to do that in the short term to improve metabolism and maybe gut health. But I don't think that's actually a long term optimal way of eating.
Yeah, that's very fair. Which brand besides your own do you think is doing it exactly right?
Brian Johnson is the person I have the most respect for in the space, and Neko. I'm really excited by both of them. Neko has been very opinionated from the start. They brilliant product, great go to market, very consistent, very thoughtful, and Brian has basically built a religion, which is very hard to do. He has thousands of people, thousands of like disciples and followers around the world, and he is very good at communicating clearly and very very good at marketing and choosing words that communicate uh, information that results in people believing something differently or taking action. So a lot of respect for to Brian.
And what do you think is one consumer product in wellness that should not exist?
Oh man, that's a tough one. Um,
Yeah, getting you to give us the dirty here.
I don't know. I think a lot of these, I don't have anything that immediately comes to mind, but I think a lot of these like pseudo healthy protein bars or drinks shouldn't exist. I think that I don't know. I don't know if anything shouldn't. Like people can do what they want. There's things I don't like, but nothing really comes to mind.
That's super fair. Well, thank you so much for hopping on, Max. It's been a pleasure to talk about kind of your take on the health world and a lot of what you guys are up to.
Yeah, likewise, man. Thank you for the chat. Enjoyed it.